Checkpoint inhibitors should work in patients with mesothelioma even after treatment with chemotherapy. That's according to research presented here at the conference.
Well, this study starts from a clinical question, whether by giving chemotherapy we do modulate and change the target of checkpoint blockade. In order to answer to this question, we looked at tumor samples for different molecules fundamental as a co-inhibitory and co-stimulatory molecules for T-cell responses. And then afterwards we looked at the same molecules in tumor samples before and after chemotherapy. And then we went to the lab and looked at in vitro at the effect on cell lines from the different histological subtypes of mesothelioma.
Right, what exactly did you do then? You had a number of patient samples from them.
So we looked at 88 tumor samples from mesothelioma, and we could find a very frequent expression of HLA class I, of ICOS ligand and B7H3. And these are all fundamental markers for different checkpoint inhibition or induction. Then important is that we looked at other two markers, which is PD-L1 and HLA class II. These were much more rarely expressed, but however expressed as PD-L1 in 16% of cases. In order to talk about, while talking about PD-L1, it's important to say that there is a major controversy on the staining, what is positive, where is the cutoff for positivity. So therefore we looked at only the tumor cells and categorized these as positive if at least 1% of the tumor was positive. Then afterwards we looked at the tumor samples of 10 patients from which we had enough tumor before and after chemotherapy, and we could see that the staining and therefore the expression of PD-L1 as well as the other markers didn't change upon treatment with chemotherapy in the whole tumor sections. And then we looked at the different markers for lymphocytes, for the immune cells in the context of the tumor, and also these molecules expressed in the lymphocytes, and therefore these lymphocytes didn't change upon treatment with chemotherapy. And we looked especially at patients treated with cisplatin pemetrexed. Then afterwards we used on the cell line cisplatin pemetrexed because this is the first line treatment of mesothelioma, or gemcitabine because this is the second line treatment of mesothelioma. And we tested with these chemotherapies the different cell lines derived from the 3 different subtypes of mesothelioma. And also in this case, the cells that were positive for certain markers didn't have any shift, any change in the expression.
Right, there was a clear difference between the peaks of the different markers in the graphs you've just been showing.
Yes, exactly. So we could see cell lines that are completely negative for some markers and cell lines that are completely positive, and the ones that were positive didn't change their expression upon treatment.
Now, clinicians may well in the future or quite soon want to use checkpoint blockade in the treatment of mesothelioma. What does your finding tell us about that potential?
Our findings tell us that cisplatin and pemetrexed in combination or gemcitabine are rational combinatorial treatment with immune checkpoint blockade.
So bottom line message for doctors elsewhere would be what?
Would be that we are not hampering, we are not precluding the use of immune checkpoint blockades by using the chemotherapy that I just mentioned.
Now, looking at practice in different parts of the world, and specifically our audience for Oncology Times, what kind of message would you like to give to practicing doctors?
Well, that this question that we made should be made for the different chemotherapy and chemotherapy regimen that we are thinking about to combine with immune checkpoint blockade, because this is not so trivial. It's very important to know what is the effect of the chemotherapy we are giving on not only the tumor level but also on the lymphocytes and also the immune system counterpart. So this is the important message, just thinking about not only the clinical rationale but also the fundamental, the molecular based rationale.
And how much of a clinical efficacy do you think checkpoint blockade might add in mesothelioma?
Well, we expect in different tumor types, it has been shown that there is response in about 20% of the different subtypes of the different tumor types. And we expect and hope this. We have seen only one major trial showing response with tremelimumab, with one antibody anti-CTLA-4, published 2 years ago in Lancet Oncology, and in this case there were 2 cases out of 29 with a response and 9 cases with stable disease, and this is a highly aggressive kind of tumor. So we are very much hoping to define and to have the chance to have immune checkpoint inhibitors in these cases.